Welcome back, Minifans. Another episode of You Make Me Sick. Today, I thought we would discuss the producers, or would-be producers, prospective producers, however you want to categorize them. And what we're going to take a look at today is something that probably hasn't been talked about much, with all the focus really being on the producer's ability to either provide content for the show or be able to produce the show adequately. Something that could be overlooked is actually possible loss of productivity. So we'll talk a little bit about loss of productivity, and I'm going to break down each one of the 5 top candidates. John Rich, Mike Montante, Mr. Andrew Augustus, Mick, and then, of course, Tommy Quinlan. So, with the back and forth between who might be the best producer to replace Cullinane, it seems that one of the issues that's probably not been talked about very much is actually their overall health of the candidates and how this might reflect on their absenteeism or being present during the show. So what we'll take a look at today is actually the possibility of their either present or past health concerns, mental and physical, and how this might reflect on the producer position that they are actually applying for. So before I start, I want to say that none of this is going to be medical advice. If you need to speak to a medical professional, please see your healthcare provider, primary care physician, whoever you go to for medical advice. Also, I want to mention what follows is all in fun. This is all completely hypothetical and speculation. I actually applaud anybody who's been in there, especially the 5 top candidates. Got a great deal of respect for all of them just for actually stepping up and going in. It's got to be really hard for them. They've gone on there, they've shared a lot about their private lives, which honestly takes balls. I don't think most of us would do that. And just to kind of get out there and blurt out things that are pretty personal. I mean, all of them except for maybe Montante, but I mean, he's, kind of the exception to the rule here, I guess. He's kind of embarrassed himself enough that he doesn't actually need to really divulge anything about his personal life. So anyway, to start, I want to say that one thing about Cullinane, you can talk a lot of crap about him, but he's been pretty consistent on the show. A couple of minor absences for him, but for the most part, he's been there pretty much each and every day without really calling out sick much. Now, if we take a look at each of the following candidates, Mr. John Rich, Mike Montante, Andrew Augustus, Mick, and Tommy Quinlan, and see if there's anything or multiple things that might hinder their ability to show up each day and do the producer role, and kind of go from there and see if maybe Kirk rethinks who he might hire just based on any kind of issues these guys might have. So I kind of want to start first off with explaining, we're going to talk about loss of productivity and what that is. So loss of productivity is the amount of time by which working life is reduced due to illness. This could be from a physical illness, it can be from a mental illness, and it also includes substance abuse and substance abuse-related absences. So that's kind of the one point we're going to really try to, the overarching point of what we're going to try to get at when we look at each of these guys. So I think to start, we'll do Mr. John Rich. So John, he had a very strong performance, actually very personal, seemed to like him a lot, but he did divulge his past substance abuse. What's great is that he's been sober since 2018, which is fantastic. What sucks is that it was heroin that he was addicted to. Thankfully, he's had no desire to chase the dragon, anytime recently, which is great. But opioids are extremely hard to quit. It's been estimated that 26 to 36 million people worldwide abuse opioids. In addition to that, there have been studies that have reported that opioids, they have rates of relapse that are extremely high, especially compared to other drugs. There was one study that reported a relapse rate of up to 91% in opioid addicts. What's good for John is that most of these relapses actually happen within like the first month to the first year, and he's been sober now for I think almost 5 years, which is fantastic. And the longer you go, there's usually less likelihood that you're actually going to relapse. That might count in his favor, that might actually help him out a little bit. But there were some red flags listening to him. The most being that he still drinks on occasion, which could actually lead to what's called a drinking-induced relapse. So drinking reduces inhibitions. And the trigger that you get from drinking also triggers the same reward center in the brain that opioids and other substances kind of trigger as well. That in and of itself could be enough to have him slip up. After a few cocktails, he's out one night, meets up with an old friend, and all of a sudden he's smoking H again. Now, hopefully this never happens. I hope he's able to stay off the H permanently. It would be great. I enjoyed him on the show. I think he'd fit in pretty well. But what if he did start to use again? How long before he's nodding off in the producer's booth, As one of the callers mentioned a few days ago, maybe a week ago now, how long before he's out on mass and cash just kind of trading hand jobs for heroin, right? Definitely a possibility. If that were to happen, there would certainly be a loss in productivity, and possibly a loss in the producing equipment too after he's pawning it just to score. Just to put in perspective with loss of productivity as well, opioid use disorder each year, it's estimated that $23.5 billion is lost to this addiction between lost time at work, people calling out of work, and I think this also counted deaths from opioid abuse. So John Rich, I don't know, so long as he can stay clean, it might be all right. If not, could be an issue with his loss of productivity. How about our next candidate? Good old Mike Montante. Big Montante fan here. And this one actually, could go one of two ways with Montante. As far as loss of productivity goes. So first one easily is alcohol consumption. This could certainly be problematic. For anyone who listened to our last episode on hangovers, I urge you to check it out if you haven't listened. Hangovers contribute to a large amount of loss of production. In the USA, the annual economic costs that are related to hangovers in terms of absenteeism have actually been estimated at $173 billion each year. What's more is that people with severe alcohol use disorder report missing 32 days of work each year because of illness, injury, or just skipping work. Now, that's more than double the number of the work days missed by people who don't abuse alcohol. I'm not saying that Montante is a full-blown alcoholic. It seems like he can pretty much control his drinking, at least enough to hold down a job and do his podcast. Seems like he's pretty social. But what happens, if he gets a lucrative producing job here in Boston? Moves up here, doesn't have to be on the road so much for his job. I could easily see his drinking spiraling out of control. The guy's going to end up working, 3 days a week, 4 hours that he actually has to be on it. The rest of the time, who knows, man, it could spiral completely out of control. His long nights could turn into rough mornings, and then there's plenty of opportunity to call out of work.
Oh, no more Yankee, my wanky.
The next thing with Montante that might be a little concerning as well is that he could succumb to heart disease at a very early age. He's already the oldest-looking 30-year-old that I've ever seen.
No shit.
I have to imagine that his insides probably match the outsides as well. I can only imagine clogged arteries, high blood pressure, and then you throw the stress of working for Kirk on top of that. Could very well contribute to a massive heart attack, and it probably will if he gets the job. And you want to talk about loss of productivity. So there was one study that found that people who have acute coronary syndrome, heart attacks, things of the such, strokes I think are included too, but they lost 59 work days following their cardiovascular events. So that's a good chunk of change right there. Hopefully I'm wrong. Montante's still young, like I said, 30 years old. Probably nothing too concerning right now. I don't know when the last time he had a physical was. But do you think Kirk is going to be willing to take the chance that old Montante will stay sober and in good health? I just don't know about that one. So after Montante, let's talk about Tommy Quinlan. Tommy was actually really good his first time in studio. Second time, obviously, had to defend himself. I still like him. He seems proficient. He seems pretty good at the producing role. Seems like a bright guy as well. And I thought he was pretty entertaining. Also seems to be in pretty good health. Seems like he takes care of himself. But that's not the day-to-day stuff that I'm worried about. It's more about Tommy's nightlife. As is well documented by now, Tommy is a homosexual man, or possibly bisexual. And recent statistics have shown that STDs have been rising among gay and bisexual men. Especially increases in syphilis have been quite profound, at least in this country. In fact, there have been studies that show that gay, bisexual men, and then other men who have sex with men have accounted for about 83% of the primary and secondary syphilis cases where the sex of the partner was actually known. So that's a pretty staggering number. Should also be noted that gay and bisexual and other men who have sex with men often get STDs beyond syphilis, including chlamydia and gonorrhea.
Reminds me of the time I got hurt.
Then there's the HPV, human papillomavirus. Well, this is actually the most common STD in the United States. A lot of times you hear about it in women because there have been connections with HPV and then cervical cancer. But in men, it's a concern as well. This is a concern because some types of HPV can actually cause genital and anal warts, and this can actually lead to the development of anal and oral cancers. So to that point, gay and bisexual men are 17 times more likely to get anal cancer than heterosexual men, and that's probably from the connection with HPV. And then there's also the consequence that comes with any kind of analingus and or oral sex post-anal penetration. Enteric bugs, so gastrointestinal bugs, they're often passed kind of back and forth in these situations, and they can cause mild to severe illness that sometimes can actually cause hospitalization in certain cases as well when there's a lot of electrolyte loss, dehydration, and a lot of vomiting and nausea. There have been sporadic outbreaks of bugs such as Shigella, E. coli, and then Campylobacter, and then parasites as well. You can get a parasite called Giardia, and then there's another one called Entamoeba histolytica, which is pretty nasty. And they've been found in men who sleep with men just from this type of activity. What's more is that Tommy's proclivity towards men of color could also be detrimental in the fact that compared to heterosexual white men, mix-oriented black men have actually had the highest odds of having been diagnosed with STDs. So there is, racial disparity here when we're talking about STDs as well in the gay community. It affects men of color more than white men, and I don't know if that's due to just socioeconomic status. I didn't really take a deep look in that, but the numbers are the numbers. So I'm just going statistically from the CDC what they're telling me. Now, I'm not saying Tommy has any STDs. I think he's probably pretty safe when he goes out. Hopefully he is. He's a smart guy. He's careful. But what happens if he becomes victim to one or more of these? How much time is he going to have to take off from work if he's in the hospital dealing with some kind of enteric disease that he got from eating out some kind of asshole? 3 days, 5 days? And then what if he's got some anal warts? And has to go to the doctor to take care of those. 1 day, 2 days? Interestingly enough, when I was looking at loss of productivity for STDs, it's actually not that staggering. The cost much less than other illnesses, and most STDs people don't actually have to lose work from. So that's one good thing that Tommy can look forward to. Even if he gets one of these, they're usually pretty easily treated. Do not typically, you typically don't lose work, don't have to stay in the hospital, but there's always that chance. So be safe out there, Tommy. And I'm not even going to touch on, obviously HIV and AIDS is still around. Thankfully, there's something called PrEP that a lot of gay men, actually, and bisexual men, can take, which is helpful. And then monkeypox as well, oddly enough, is still out there. Not so bad here in the U.S. Other parts of the world, it's become a little bit more problematic. But that is also one of these diseases that they found was far more prominent in men who sleep with men. And also, unfortunately, men of color as well. So Tommy, watch out there, man. Be careful, all right? Now, I don't think any of this will influence Kirk's decision, especially with loss of productivity. Like I said, the loss of productivity for STD is not very high. There was one study that found that, it was $260 for chlamydia, $197 for gonorrhea, $419 for syphilis. So, and that's just the cost of the average productivity losses per disease. I don't know how that actually equates into days lost. But when you look at the, millions and billions of dollars, when you're looking at hangovers or, some of the other things that I mentioned, opioid abuse, it's not that big. So, anyway, regardless, for all of you out there, straight or gay, use protection if you're going to be out there having fun. Be careful, especially our friends in the gay community, and especially males. We are, males in general are more aggressive and usually more careless and don't put a lot of thought into it once we get revved up. So be careful out there. All right, that's Tommy. How about Andrew Augustus? Oh, Andrew. So, Andrew revealed to us that not only was he diagnosed with what he called a hole in his brain, but that he also had a stroke. I can only assume that the hole in his brain that he's talking about is something that's called a cerebral cavernous malformation. I could be wrong. If I am, let me know, Andrew. This is just kind of what I'm assuming. So cerebral cavernous malformations, they're also known as cavernomas and cavernous angiomas. They're essentially just little clusters, abnormal clusters of really, really tightly packed blood vessels. They're capillaries, and what they do is these form little lesions in the brain that kind of move tissue in the brain and the spinal cord from their normal place, and this kind of alters the blood flow in the brain. Really serious, really dangerous. As in Andrew's case, he had a stroke from it, but highly treatable. His, obviously, I believe it sounds like it was treated, and it doesn't sound like he's going to have any other kind of neurological complications from that, which is great. What I'm more concerned about beyond that is the actual stroke that he suffered. I got to give him credit. Like he said, 3 months without being able to move. It takes a lot to come back from that. The physical therapy alone is insane. So all the respect in the world to Andrew. But with strokes, per the American Heart Association, more than half of the people who survive a stroke actually develop some kind of cognitive impairment within the first year after their stroke.
Okay, no.
Now, I'm not saying that Mr. Augustus has any kind of cognitive impairment. He seems relatively sharp, but does seem somewhat erratic at times. It's perhaps this behavior may be associated to the prior insult in his brain. Hard to tell. I'm not sure where the stroke was located in his brain, but impulsiveness in particular is often associated with both frontal lobe strokes and a stroke in the temporal lobe of the brain. And this plays a pretty big role in judgment and decision making, particularly when the right side of the brain is affected. And it sounded like he had left-sided deficits, and when you have a right-sided brain injury, it's contralateral, so the left side is what's affected. If you have a left-sided brain injury, usually it's the right side that it's affected. So I have a feeling that he might have had a right-sided brain injury, which could really alter his judgment and decision making. So, how does this all relate to loss of productivity? Well, impulsiveness and poor judgment in life often leads to accidents. And doesn't Mr. Augustus seem the type that might be prone to accidents? He seems like the type that might stick his dick in a vacuum cleaner just because he thought it might feel good. And then he has to go to the ER and becomes a fiasco. Anyway, these types of strange and impulsive behaviors, they may be kind of concerning to a future employer, such as Kirk. He's looking for a consistency and reliability, and when you have someone who's out there participating in strange and sometimes weird behavior, you have no idea if that person's actually going to show up for work. Now, I'm not saying that Andrew Augustus participates in these behaviors, but after listening to him, and I enjoyed him on the show, I actually really like him a lot, but he does seem to wander and be a little bit impulsive. If this impulsiveness leads to lost work time due to self-injury or even incarceration, could be a burden to the show. I will say there was one study that found that workdays due to all types of non-fatal injuries, when you combine them together, were about 11 days missed per year. That's for the overall population, and that's for people who don't have issues with impulsivity. So think about somebody who does, if they have increased impulsivity and poor judgment. Could definitely see that 11 days of lost productivity becoming even more than that. So Mr. Augustus, something to watch out. I don't know if he's truly impulsive or not, but from listening to him on the show, definitely a little bit erratic. And lastly, we have Mick, beyond average Mick. There seems to be a profound hatred for Mick. I actually really liked him on the show. I enjoy anybody who can piss a lot of people off. There's truly an art to that, and I think that Mick he's certainly good at it. So, what might prevent him from being a productive hire? What could actually, lead to a loss of productivity with him? So, Mick was also very open about a health condition that he has, his Crohn's disease. So, for people who don't know, Crohn's disease, it's a chronic disease. And it causes inflammation in your digestive tract. It's an autoimmune disorder. It can affect any part of the GI tract, anywhere from your throat to your anus. But usually, typically, it's the small intestine and then your large intestine that are affected. Crohn's is considered inflammatory bowel disease. It's in that family of diseases. So why should this concern Kirk? Why might this lead to some kind of loss of productivity? Well, like many other inflammatory bowel diseases, those with Crohn's tend to have flare-ups. These flare-ups are often very painful, they can be debilitating, and sometimes require hospitalization depending on how bad they are. The flare-ups, though, they can be caused by a lot of different triggers. But one common one is stress. So I can't think of a more stressful job than trying to please Kirk day in and day out. So how long is it going to be before Mick just succumbs to the stress, his Crohn's flares up, and then he winds up having to bang out of work for any number of days just because because it's so painful and debilitating? To cite a recent study from 2020 about Crohn's disease and loss of productivity, this was in the Journal of Medical Economics, people with Crohn's disease miss about 9.36 workdays a year due to medical-related absenteeism. It doesn't seem like a lot, but I don't ever remember Cullinane missing 9 days of work. That being said, Mick doesn't really seem fazed by the pressure, so maybe the stress of working on the show wouldn't be a problem at all. But even if that isn't an issue, even if he doesn't get flare-ups and doesn't call out, how many hours are going to be spent with him on the toilet?
It's a bowel movement.
He's already shown us that he has an all-access card to any bathroom on the planet due to his urgency. Once again, irritable bowel syndrome has a lot of different triggers. Who knows? Maybe Mick eats something wrong before the show. Maybe somebody during the show really gets under his skin and this causes it. Who knows? So can he be reliable? Maybe, maybe not. I don't know. Cullinane seems to like him for the job. Everybody else hates him. So I know that when somebody's hated, Kirk loves them. So who knows? So that's kind of my take so far, just as far as, one aspect that really hasn't been looked at with loss of productivity. Looking at, kind of physical, mental problems mental health and physical health problems that the candidates have. I'm sure I didn't even go into the true mental health problems that some of these guys probably have, but touched on what we know about them anyway, just from their own personal histories. As I said, this is all in jest. It's all in fun. I do respect, everybody who's trying out for this producer role, even if you weren't featured on this. It takes a lot to go in there and just put yourself out there. So I applaud you all. You've all been very entertaining as well. I appreciate the fact that, like I said, you just have the guts to go in there and just take a load of crap from all us Minifans, because we're a vicious group when we really get down to it. So that's my take on the front runners. I also want to say addiction's a serious issue. I talk about alcohol addiction. I talk about opiate addiction. I'm actually really happy for John Rich. I hope he continues with his sobriety. If anybody's having issues with addiction, I urge you to try and speak to somebody, get help. It's a lifelong challenge for most people, and it's something that should be taken really seriously. But that's about it as far as the show for today. I do want to say, in my opinion, what I think Kirk should do. Kirk, I know you're probably not going to hear this, but if you happen to listen, I think you should hire 2 producers. Whatever you're paying Cullinane, split it down the middle. They each get half. And, I think an Augustus Quinlan duo would be fantastic. At the same time, a Montante with anybody would be pretty entertaining as well. But easiest thing to do, you let those 2 kind of produce, give them each a year contract, and at the end of the year, see if any of them are still there. If one's still there, if they're both still there, then rework the contract. If one leaves, maybe the other person ends up reaping the benefits, and you pay them a little bit more of what the other person was making. But 2 people, many hands makes light work. I guess they could fuck things up twice as bad too, but the more help is always better. And I think that, at least 3 or 4 of these guys would probably be willing to take lesser pay just for the opportunity. At least they should. It's a huge opportunity for these guys. So, anyway, hope you guys all enjoyed. Hope to be back soon at some point. Still plan to do collaborations with a lot of the other Minifans. The last month and a half, 2 months, it's summertime. Everybody's been busy, so it's been a pain in the ass trying to organize anything. But hope to talk to you guys again soon. As always, any feedback on Twitter at MakeMeSickPod. I can also be reached Gmail, YouMakeMeSickPod@gmail.com. So any requests, suggestions, if you want to tell me just to go fuck myself, you can do that too. But as always, and as Kirk says,
I always wash my hands. I'll say it. I'll say it. Yeah.
remember to wash your hands, guys. Talk to you later.
Hell, I like you. You can come over to my house and fuck my sister.
Oh, no more Yankee, my wanky. The donga need food.